Hello, everyone. Today I'm joined by Dr. Smith, who is a podiatrist. Welcome.
Hello, Dr. Siddiqui. It's great to see you again.
As you as well. So before we get started, tell us a interesting experience or story that you want to share with us.
Okay, I guess something interesting when I, as a first-year resident intern, met one of my first consults that was pretty scary. Actually, he's a well-controlled or somewhat controlled diabetic that came in with a abscess on his foot. So the ER called me, said, "Okay, what's going on?" And me as an intern, I'm just going in. I have no idea what's going on, to tell you the truth. All I know is I got a little bit of knowledge and a little gung ho. So I talked to him about it. I figure out that he's got a really bad infection. I let him know, a lot of things can happen, and we have to make sure that we treat this very aggressively because it could potentially be bad for him. So what happened was, I eventually took him to the OR that night, and we did an extensive debridement. He had a lot of really bad bacteria in there. And eventually I told him, I'm like, we have to do this so quickly because there's a 1/3 mortality rate on something like this because it's so extensive. So we did several debridements on him, and by day 3, sad to say that the gentleman passed away. But it was true to the literature. By day 3, there's a 30% mortality rate in necrotizing fasciitis. So that hit me really hard. And it was, after then, I always focused on the literature whenever dealing with patients. But it was pretty eye-opening.
Very interesting. So tell us a little bit about yourself. Who are you? What do you do?
Okay, well, I recently graduated from Chino Valley Medical Center. I went to medical school at Western University of Health Sciences, literally born and raised in Southern California my entire life. So I knew that I wanted to be in private practice pretty much from day one. So I started moonlighting my 3rd year of residency and was in about 3 different clinics, very, very busy. And I turned down a couple options. And finally, now I'm working with a well-known podiatrist in the area, foot and ankle specialist, that apparently he's got his own residency, and I'm in the makings to possibly be a partner and get very well integrated into the residency. So I'm set up pretty well.
That's amazing. So tell us, how long did it take you to become a podiatrist? Did you have to do a fellowship, or how did you go about this?
So up until 2010, there were different tracks for a podiatrist. You could either be a 1-year, 2-year, or 3-year trained foot and ankle specialist. Mm-hmm. So as of 2010, they standardized it. So if you were a podiatrist getting out of school after 2010, you would have to do at least a 3-year residency, fellowship if needed, and all that kind of stuff. So I did a 4-year medical school at Western University of Health Sciences, 3-year residency, and then fellowship for us is really if we want to specialize in something that we didn't really get in residency, that's what fellowship's for. Now, I had a really good residency and I was really well trained there, so I don't feel like I need to embark on anything more than that. I'm happy where I'm at for private practice, and I think I'll do great.
That sounds great. Let's talk about some of the challenges and struggles you face going into the medical field. I know you have, you're married and you have, a dozen kids?
Yeah, we're collecting them. So I think I got married pretty early, and I started having kids really early, and that was kind of a deterrent for me. It's everyone was saying, "No, you can't go back to medical school. What are you thinking? You already have 2 kids in the oven and all this." No, not. So, I didn't take that really to heart. I knew that I like to work and I like challenges. So, going into medical school, I had 2 kids. I had another kid during my 3rd year medical school, and then another one during residency. So now we have a small soccer team cohort going on, doing my own little studies at home with them, but it's good. The challenge is obviously to balance life and work, and I think you just need a good partner. And you need, just like you did in medical school, you need to keep your head down and just focus on what you want to do and get it done. I've always been a strong advocate of never having an idle mind, because if I have nothing to do, nothing good happens. So I keep busy, I keep studying, and I do a lot. So I play soccer still. I played soccer in college, and that's what I do when I need to de-stress. So I'll play soccer, 2-3 days a week. I'll be with my kids. They have 2 boys, 2 girls, 2 in soccer, 2 in baseball, 1 in dance. So I'm busy, but I think we make it all work because we're a team. And I think that's how you got to make it work.
That's huge. Absolutely. So let's talk about private practice. I know going into private practice is difficult. So what are the options? What can others who want to follow into your footsteps, what can they do?
So private practice is difficult because everything that you do in private practice is not really trained in residency. Like billing, coding, insurances, all this stuff. It's like it's a whole new world. So luckily, I went to a residency that taught a lot about billing and coding with the residents. So I've had 3 years of training in billing and coding. So in terms of knowing all that stuff and that's like getting you in the door, but also there are a lot of the problems are that you need to know about insurances and getting on plans with different companies. So where I am in the Inland Empire, there's a lot of foot and ankle specialists. So in order to get on those plans, if you were to just go to those contractors and be like, okay, well, I'm a new foot and ankle specialist, can I get on your plan? They don't necessarily let you unless they have a reason to. So if you're in a group or you're with someone who's already on their team, you're much more likely to be able to get onto that contract. And that's where you're going to get the patients. It's not like you can just put up a shingle anywhere and be like, okay, I'm really good, guys, just come see me. Because that's not how it works anymore. People don't pay by cash. They pay by the insurance, however insurance they have. And, in order to get on those plans, sometimes you have to kind of move mountains to do it. But I would say if you're looking into private practice, you want to get into either a small group or someone that already has the contracts in their capability so that they can put you onto that contract and so that you can be a part of their team. It's very hard to start a private practice from scratch. So if you go on and you buy a practice and then you are already on those contracts that kind of start you, then you can start doing everything, the advertising to really make yourself well known, but you need some sort of baseline to start. So when I began looking for my, what kind of private practice I wanted to be in, there's usually a 3 to 4 month wait before you actually get paid from these contracts. So you can either jump onto something that gives you a salary on a regular basis for it to start, or you have to wait till all those contracts start paying you the money. So usually there's a 3 to 4 month time gap before you even get paid. So it's a little bit of wiggle room in there and try to figure out how to do all this. But I think billing and coding is kind of the foundation. Once you start that and you know how to do that, then you know how to make money and there's an incentive for the person to hire you. Does that kind of make sense?
Absolutely. Those are stuff that, a lot of residencies don't discuss. Those are things that, once you're out in the real world, you are kind of bombarded and you're like, how am I going to handle this? So I think that's great advice. It's something that it's eye-opening, something to be aware of. Absolutely. So let's talk about telemedicine. Is there any role of telemedicine in podiatry? What are your thoughts on telemedicine?
No, I think for sure. I mean, if you can set yourself up in that community and in that, with the electronic systems and all, I think it's totally already there. But it's about making yourself known and obviously getting to the foundation for patients to see you. I think if you can set yourself up in the proper position and you can meet enough people, it's totally viable. But like I say, for you, you're already 100% there. You could probably start an entire company where you are because the amount of education that you have and the amount of education that you bring to the followers and all that kind of stuff. I think that I think it's very, very possible. But like I say, it's not easy for everyone. For someone like you that started so long before and has a great foundation for it, I think the sky's the limit for sure.
Absolutely. So what are your thoughts on student loans? How much student loans do you have, and how are you going to tackle this?
Okay, so student loans, I have a lot. So it's almost like I've already bought a house that I don't live in. I'm never going to see, but yeah, it's massive. So you have to understand that medicine is expensive, and no matter what direction you go into the field, you're going to have to invest in medicine before medicine's going to pay out. Now, in paying back loans and stuff, they have income-based repayment, so that if you're not making the income that you want to initially, they'll work with you so that you can make some sort of payment, and eventually you'll get it paid off. But I know several attending and several doctors that still have student loans, and it's not something that you should really consider in terms of all the things you have to do. Eventually you'll pay off your loans, but it's not something that's going to make or break you in your practice. nothing that they're going to hold over your head, so you wouldn't be able to necessarily buy a practice because you have a student loan. The student loan in the US is just something that everybody knows that doctors have. So it's something that's not necessarily going to destroy you. And you shouldn't even really consider it when in considering what you want to do, because you have debts, assets, and that kind of stuff. But this is something that everyone has. So it keeps you kind of on a level playing field. And I have a lot of loans, and eventually I'll pay them off, but not today.
That's the mentality. All right, so let's talk about, is there anything you regret going into medicine? Is there, looking back from where you are at today, is there anything that you would want to change?
To tell you the truth, no. I'm the kind of person that doesn't, everything that I do, even good or bad in the end, I don't really regret it. But also, I started out, I played soccer, you know, when I was 4 years old. I played soccer in Costa Rica. When I was 8 years old, I played in club, played in college. So foot and ankle is always what I've been exposed to. Injuries, healing time frames, all that kind of stuff, that's kind of my thing. So in becoming a doctor, I was also an EMT for a while, and I loved the aspect of medicine, but I wanted more. So for becoming a foot and ankle specialist, doctor, surgeon, that was the next thing for me. It's like I knew that I didn't want to do 5 to 7 years in ortho and do hips and knees and shoulders and eyes and everything else. I just want to do foot and ankle. And it was the best pathway for me, because I got exactly what I wanted to do, very focused. And when you think about those guys that, you know, they started out in one field, maybe they were in the shoulders for a while, and then they did hips, and now they see everybody. So they do maybe primarily a few different things, like the general orthopedic surgeon. But then when there's a real problem about a specific small detailed organ, so like the foot, ankle, knee, shoulder, you send it to the guy that's really good at that one joint. So for me, I like being the specialist in that joint. So foot and ankle is my thing. And I don't regret how it took, however hard it was to get here. I'm happy I got here, and I don't regret it.
Wonderful. All right, so what about medicine? Is there anything in medicine that you'd like to change? I mean, there are things that we encounter on a daily basis, so you know, stressors, certain things that we get frustrated with. So what is that one or two particular things that frustrates you about medicine that you would like to see change in the near future?
Well, I mean, I think in order to treat the person, you need to treat them with everything they have. So in terms of vascular, in terms of their comorbidities are very important, especially for these diabetic patients that have so many problems. So we're trying to centralize medicine so they can see all these specialists in one specific area. But I think with the internet and like this video conferencing that we have available, it could be so much more fluid. And I think the barriers to medicine come in that no one's making money on the fact that you see so many specialists at one time. And so that's why you don't see all the specialists you need to see. So if there could be a system implemented where all these specialists could be in one place and the patient could get, you know, almost everything they knew quickly, that would be so much better. Like I have a strong HMO patient population. So everything requires authorization. Everything requires, you know, there's a step before I can really get you the help you need for the next, you know, the level of treatment. But that barrier doesn't necessarily have to be there. And I think financial gain has made those barriers and those walls very difficult for us to, you know, really treat our patients collectively and as a whole. And I think if we could figure out a system that could streamline this, I think we would all, you know, do better in the end, and we'd really help our patients.
Absolutely. So there's this thing in primary care, there's direct primary care, which I don't know if you've heard of it, where they sort of have like a monthly subscription, like, you know, going to the gym, you have a monthly subscription. So you have that with your primary care doctors, at least with family physicians. Is there anything like that with podiatrists? It's not necessarily concierge medicine, but it's kind of like a derivative of it.
So there is in places, in locations. So in where I'm at in Lakewood, there's not a lot of that because of the patient population, because of the, they don't have some of the advantages of some of the other, like Beverly Hills and, you know, the other clients. But I think there definitely is something like that in Beverly Hills, but that's not really where I'm at. So I don't see a lot of it, but it does exist in some realm.
Yeah. Okay. All right. So let's talk about some advice and tips that you would give for, pre-med students or medical students that are trying to go into podiatry and get into podiatry residency.
Okay. Well, you have to understand there are not very many podiatric schools. So, and Western University of Health Sciences is going to be the hardest, most difficult school in the country by far. And it's hard because we are taught alongside our DO counterparts, and we are responsible for the same things that they do, meaning we take all the same tests, with the exception of we have foot and ankle surgery when they have the osteopathic manual manipulations course. So I think that it's important in medical school to get as much as you can, because the more that we as podiatrists can know and know about medicine and be able to talk to our other specialist colleagues like the vascular surgeon and the respiratory therapist and all the other people, the more we are involved with it, the better we can treat our patients. It's not going to be an easy course, and you don't want it to be easy, because if it's easy, then there's something that I think was missing. It should be difficult, and nothing is really worth doing if it's not a challenge to you. And that's something that I've always kind of lived by. If it's something easy, I'm not really interested in doing it. It has to be something that's going to challenge me, something that's going to keep my interest and to keep me going and give me some sort of, I don't know, passion, some critical thinking, something like that involved along the way. So, I mean, I would say do your research. I would say shadow the specialist, whatever specialty you want to do. If you want to be a podiatrist, then shadow a podiatrist that is doing the things that you want to do. I'm sure in medicine, if you want to be an internist, you want to shadow an internist, see what their day-to-day life is like, and see if that's where you want to be eventually when you get out of school. It's important to not shut any doors early. Keep all your options open, and then once you figure out something that really fits with you and you really have a piece about, I mean, just put your head down and get it done. But until you have that piece about where you want to go and what you want to be, you're kind of going to be, just twiddling your thumbs and kind of not knowing much. So it takes that really diligence to see where you are as a person, see where your thought process is, and see where you're going to succeed. And then like I say, you need to try your best, and eventually you'll get it done, but it's going to take work. And it'll be worth it in the end.
Absolutely. Well, thank you so much for joining us and sharing your valuable time and tips with us and our viewers. We truly appreciate you.
Dr. Zeke, it was a pleasure, and I appreciate you even offering to let me be on your program. It's amazing. I think what you're doing is fantastic, and I just, a big thumbs up from me.
Thank you. So everyone stay tuned. We'll be uploading videos weekly with different specialists. And if you like this video, give it a thumbs up, comment, and leave us comments down below telling us what you would like about this video and if you prefer other specialists to be interviewed.
Thank you, Dr. Siddiqui.